Hey, it's Adam Sewell, MD, and welcome to Section 3.3 of the Microplastics Toxicity training. In this section, we'll examine how microplastics interact with the human immune system and trigger chronic inflammation, both locally at barrier sites and systemically across organ systems. This is one of the most clinically consequential topics in the entire course, because it connects environmental exposure to real-world symptomatology, the things our patients are already coming into clinic with. Part 1, Microplastics as Immunological Triggers. Microplastics are recognized by the immune system as non-self. They're synthetic, non-degradable, and chemically foreign. When these particles enter human tissue, innate immune cells, especially macrophages and dendritic cells, respond as if to a pathogen. Macrophages attempt to clear the material through phagocytosis, but for particles larger than approximately 1 to 2 microns, phagocytosis is incomplete or fails entirely. This leads to frustrated phagocytosis, where the cell releases reactive oxygen species, ROS, and pro-inflammatory cytokines like tumor necrosis factor alpha, interleukin-6, interleukin-1 beta, and monocyte chemoattractant protein 1. This creates a persistent inflammatory microenvironment. In animal models, polystyrene microplastics have been shown to induce granuloma formation, macrophage activation, and upregulation of inflammatory genes in gut and liver tissue. Jin et al. In 2019. These same cytokines are also involved in chronic inflammatory diseases such as RA, type 2 diabetes, and neurodegeneration. Part 2, Gut inflammation and microbiome disruption. The gut is both a major site of microplastic exposure and home to 70% of the immune system. Studies show that oral exposure to microplastics disrupts tight junction proteins, including zonula occludens 1, occludin, and claudin 1, compromising epithelial integrity. This leads to increased intestinal permeability, often referred to as leaky gut, which allows endotoxins like lipopolysaccharide, LPS, and food antigens to enter systemic circulation. These trigger toll-like receptor 4 and nuclear factor kappa light chain enhancer of activated B cells pathways, amplifying cytokine production and immune activation. Microplastic exposure also alters the gut microbiome, reducing beneficial genera like lactobacillus and bifidobacterium, while promoting inflammatory strains such as enterobacteriaceae. Dysbiosis and mucosal inflammation have been linked to conditions such as inflammatory bowel disease, celiac disease, and autoimmunity. A 2022 study in environmental pollution found that mice exposed to polystyrene microplastics developed intestinal inflammation, elevated interleukin-1 beta and tumor necrosis factor alpha, and microbiota imbalance in less than 4 weeks. Part 3, Systemic immune dysregulation and chronic inflammatory states. Once inflammatory mediators, and in some cases particles themselves, enter circulation, they can influence distant tissues. The result is systemic low-grade inflammation, or inflammaging, which is increasingly recognized as a driver of chronic disease and metabolic dysfunction. Persistent microplastic exposure leads to activation of pattern recognition receptors, for example, toll-like receptors 2 and 4, ROS generation and oxidative stress, disruption of immune balance, favoring Th1/Th17 responses over TREGs. This contributes to the pathophysiology of autoimmune conditions, for example, lupus, Hashimoto's, psoriasis, neuroinflammation and cognitive symptoms, brain fog, metabolic syndrome, through insulin resistance and endothelial dysfunction. In clinical terms, this may manifest as chronic fatigue, joint pain, poor wound healing, and relapsing inflammatory flares, all of which are often misattributed to stress, aging, or lifestyle. Part 4, Immunohistochemical markers and tissue models. In histopathology and research models, microplastic-induced inflammation is being validated through marker analysis. Macrophage markers, CD68, CD163, oxidative stress, 8-hydroxy-2-deoxyguanosine, inducible nitric oxide synthase, fibrotic progression, transforming growth factor beta, alpha-smooth muscle actin. In intestinal tissue, we see villus shortening, crypt distortion, inflammatory infiltration, downregulation of zonula occludens 1 and occludin. In lung models, especially in mice exposed to polystyrene particles, transforming growth factor beta expression is increased, suggesting progression toward fibrosis. This is particularly concerning in patients with asthma, chronic obstructive pulmonary disease, or long COVID phenotypes. These findings may soon pave the way for diagnostic panels that detect inflammation patterns suggestive of microplastic exposure, even when direct polymer quantification isn't feasible. To summarize, microplastics are biologically reactive materials. They activate immune cells, provoke inflammation, and remodel tissue structure over time. The immunological effects are not just local, they're systemic, and they may help explain a wide spectrum of non-specific chronic symptoms in today's patient population. We've now explored how microplastics enter the immune landscape. In the next section, Module 3.4 will move to another pillar of microplastic toxicity, endocrine disruption. We'll examine how microplastics and their associated chemical additives like BPA and phthalates interfere with hormonal balance, fertility, metabolism, and more. Thanks for staying with me. We're building the full pathophysiological map, one module at a time. I'll see you in section 3.4.